Doctor, do you say there are several forms of dermatitis? Yes, there are. Such as what, doctor? Well, in which a bullous eruption develops, but they are distinguished from true bullous diseases by a short duration and good prognosis. Doctor, the term pemphigus is derived from what? It is derived from the Greek pemphix, blister, which points up the chief characteristic of pemphigus vulgaris. Doctor, that is the formation of blisters, is it? Yes, it is. These blebs arise suddenly on apparently normal or slightly erythematous skin and form oval-shaped or round blisters containing clear serum. Doctor, the blisters tend to be flaccid, do they? Yes, they do, and they break easily. Doctor, the epidermis becomes detached, does it? Yes, it becomes detached, leaving increasingly larger areas of denudation. The Nikolsky sign is always positive. Doctor, I did not ask you that. Well, I am volunteering that. You say, doctor, it is obtained by pressing on the skin with the fingertip? That is right. And the epidermis then slides off, does it? Well, it slides off and a raw surface remains. Doctor, the denuded areas are slow in healing, are they? The denuded areas constitute a continuous threat of infection. Is it true, doctor, that pemphigus has been compared with a serious burn? Yes, it has, but in reality the trauma of a burn is a single occasion and the lesion is frequently localized. Doctor, on the other hand, the injury inflicted upon the skin by numerous crops of bulli followed by widespread denudation presents what? It presents a still graver problem than that of many a burn. Is it true, doctor, that the blisters vary in size? Yes, they do. As to what? Well, from a few millimeters in diameter to 10 centimeters. Doctor, new lesions develop, do they not? Yes, new lesions do develop while old ones disappear. Is it true, doctor, that since the crops arise rapidly, often overnight, and old lesions heal slowly, the areas of denudation are extensive, are they not? Yes, they are extensive, and crusts form over the raw surface. If pyogenic bacteria get underneath these crusts, foul-smelling pus collects and increases the patient's physical distress. Doctor, there is no scarring, however, is there? Well, there is a hyperpigmented lesion which remains after healing. And that is the formation of bulli? Yes, the bulli in the oral cavity particularly is painful. Doctor, what about the blebs? The blebs, which are about 5 millimeters in diameter, are scattered over the buccal mucosa. Doctor, they appear spontaneously, do they? Yes, spontaneously, and they rupture and leave raw ulcers which inflict much pain. Are blebs, doctor, occurring on other orificial mucous membranes? Well, the etiology of pemphigus is still unknown. Some authorities believe that it is a metabolic nature or caused by bacterial or viral infections. However, no theory has yielded convincing evidence. Is it not true, doctor, that the common type of pemphigus is a chronic recurrent disease? Yes, that is true. Afflicting only adults, however, the acute exacerbation may be followed by brief or prolonged periods of remission. Doctor, as a rule, pemphigus vulgaris lasts for how long? Well, from several months to years. Untreated, it is a fatal disease, but with the judicious use of cortisone, the prognosis is often favorable. Doctor, the seborrheic keratoses are what? They are epidermal lesions, frozen with ethyl chloride and curetted in order to operate. And the operation is what? The operation is an epidermal curettage. And does it involve basal cell carcinoma? Yes, it does. That is the curettage, the lesion and all extensions removed with skin curette. Doctor, the remaining cells are what? The remaining cells are destroyed by surgical diathermy. And do you apply electrodesiccation to the skin? Yes, we do.